Okay, so
can I just say while you're looking there, some people would rather be right than happy. And you know, and so they get into it about belief systems, and I think that a lot of beliefs, they take it just because that's their family belief, their cultural belief, or whatever, and they don't look at it as a personal experience belief. Like, I mean, how is it for me? What is going on in me, and how do I relate to myself and my sexuality and with someone else? So a lot is exploration, but we still have those beliefs. And I will say this, that if they have a belief that sabotages their relationship, they can actually make themselves sick. In fact, I find that people that have cancer or growths in their sexual organs will always have a sexual partner involved in that. There will be emotional stress that is unresolved, that's held inside the body. And even though they think they're okay in this relationship, they're not on a subconscious level. So that can be discovered very quickly through muscle response testing.
Okay, so our next two questions have to do with infertility. So what role do you think genetically modified foods play in infertility?
I think it's a little too soon to speculate. I'm not sure that there's any real evidence on that. I mean, environmental science is looking at issues like this, and pesticides, endocrine disruptors. I think there's a lot more evidence in that field than genetically modified foods. I think I would be reluctant to take a position on that without any real proof. I mean, part of me would like to say, yes, of course, you know, anything that is supposedly not natural, but I think that's it would be rash to come to a conclusion.
Okay. Anybody else?
Sure. So genetically modified foods, we know, do interfere with the bacteria in our gut and the genetics and so forth. The bacteria that's in our gut has a lot to do with how we assimilate our food, how we assimilate our hormones. Hormones are signals. So in that way you can draw a conclusion that it definitely can have something to do with it. Also, our reproductive systems are one of the first places where our body will tuck away things that are not safe to be exposed to the rest of the body, such as in our bloodstream and our immune system. So that's one of the places that they'll tuck away toxins, so, or heavy metals, or even bacteria and viral components. So often with people who do have infertility, there can be a detox issue. Even in our water is very unclean. So also there can be immune factors, there can be emotional factors, fear, guilt. So yeah, I think it can be tied, but not a lot of money is spent on small research projects like that. Most of the money in America is spent on big pharma. So what does it cost? $5 million to develop a drug with the research and so forth. So you got to make sure you got to have at least 1 million people in the country on the drug to pay for the past research and so forth. Research on smaller medicine that has a longer tradition, way back before the 1940s when the miracle drugs were discovered and we became fantasizers of miracle drugs. We have a long tradition. All Oriental medicine, naturopathic medicine, psychology, this is all an old traditional medicine. Homeopathy goes way back, so there's a lot of science to it, but not a whole lot of money is spent on the constituents and so forth and how they're related. And the same thing holds true for nutrition.
I just have to make a comment on this, and on fertility. Dr. Beeler, an MD, did a lot of research on this and found that toxicity in the body definitely held a bearing. So many years ago, 27 years ago, my daughter called me and said, "Mom, we've been trying to get pregnant. We can't get pregnant." And I says, "Well, I'll tell you what, honey, there is a way that you can. And if you're willing to go on a cleanse for 2 weeks, and just liquid cleanse, then what happens is not only does the body get rid of a lot of toxicity, but it also goes into almost like a starvation. When that happens, the body produces enough, or releases the ovum so that you'll get pregnant to preserve the race." So I'm saying there is an answer, and my granddaughter, who's sitting in the second row, is the daughter that came out of that. She got pregnant. My daughter got pregnant 2 weeks. At the very end of that cleanse, she got pregnant with this gal right here. My granddaughter said, right?
That's a hell of a testimonial.
We have one last question. I'm just going to throw this one out here. One of our guests had a history of childhood leukemia, left him with a chance of 4% of the ability to father a child, and he wants to increase his fertility. Is there something anybody would like to suggest or comment? Or we need more information? Maybe that person could come up and discuss.
Actually, it's not that difficult because I've already worked on enough of them. Siberian ginseng and getting some natural male hormones, finding out if there is toxicity, doing a sperm test, taking a look at the sperm, getting the count, and if they're normal. There's a lot of sperm that is actually defective. They are not normal sperm. And so you can work with it nutritionally and emotionally and then retest it and get that sperm where it should be, and it really does work when they do that. Okay.
I assume nothing. I muscle test the person I wish to father a child. And then if that holds, then I say, would you say this? And I'm willing to father a child. And I can't tell you how often, I'm not saying anything about whoever this is, that they may wish, whether it's, I wish to lose 40 pounds. I'm willing to lose 40 pounds. It doesn't hold. What are your chances of losing 40 pounds if you want it but you're not willing to do it? As you said before, there's usually a conflict in our subconscious, and I don't care what diet you choose or what doctor you go to or what sperm count you have, until you deal with what's in that individual, you're headed nowhere. And we don't know everything that's inside of ourselves because it's not all up here. Of all the inputs bombarding us through the day, a very small percentage do we allow to come into our consciousness. It comes into what I call our awareness. Awareness that's a body awareness, not an intellectual awareness. And that stuff is really running us, not what we think. We overvalue thinking in our culture and not the other stuff, the feeling. And yet that's what's running us. So that's why I find it so helpful to use applied kinesiology, because then you find out what's really going on. And it isn't like I'm telling that to the patient. The patient is discovering by himself that his arm holds when he says that. And then you see that look on their face, and that's the moment when the truth comes. And then you have a chance to do something.
Okay, well, that is our meeting tonight. Thank you very much to our panelists. I want to thank you all for being part of this group discussion tonight. This is my last meeting hosting the integrative discussion group at Pacific College.
Damn, dude.
So thank you. So I am leaving my administrative role at the college to go back into private practice and teach, and I'm working on my doctorate. So I'm really excited. I'm going to be passing the torch. We've hired somebody fabulous to replace me, and she's actually here, so I'm going to let Angela Yvonne raise her hand just so everybody can get to know her, because she is the next So we're going to work together, and I'm also going to be doing something like this with UCSD, and it's a possibility that we might combine the schools and do something even larger. We've seen a lot of growth. It's been 6 years, and it's been really wonderful to see the community of integrative medicine in San Diego grow, and it's been my honor to serve all of you.
Thanks.